Kenya's President Uhuru Kenyatta on Wednesday lifted the dusk to dawn curfew that has been in effect since March last year to contain the spread of COVID-19. President Kenyatta also allowed for an increase of the capacity of congregants in places of worship from a third to two-thirds of capacity. He was speaking during celebrations to mark Mashujaa, or Heroes Day, in honor of the country's independence heroes. Malawi's President Lazarus Chakwera was this year's chief guest. Now, the dusk to dawn curfew was put in place in March last year after the country's first positive case of COVID-19. The curfew has not only affected movement, but business people, including bar owners, hoteliers, taxis, amongst others, as the country came to a near close at 10 p.m. Now, the curfew also claimed several lives in the hands of police as they attempted to enforce the restrictions on movement at night. President Kenyatta says that although Kenya has not met its target of vaccinating 5.8 million people by the end of Wednesday, it has made strides in containing the spread of COVID-19. President Chakwera, who's in Kenya on a three-day state visit, spoke and shared the history between Kenya and Malawi as what binds the two nations. Chakwera will on Thursday sign bilateral agreements with Kenya to cement their relations.
Therefore, given the progress in containing this disease, the committee, jointly with the Council, has recommended a review of the existing containment measures. Accordingly, the number of persons gathering for in-person worship is now reviewed upwards from 1/3 of the congregants to 2/3, provided they adhere to all the health protocols. In the same regard, and by the authority vested in me as President, I hereby order and direct that the nationwide dusk to dawn curfew that has been in effect from the 27th of March 2020 be and is hereby vacated with immediate effect. Asante sana, God bless you, and God bless Kenya.
Today, Kenya's joy is Malawi's joy. For us, the struggle for independence in Kenya and Malawi is one of the things that binds us together. Indeed, it is no accident that the city of Mzuzu in the north of Malawi, the city of Lilongwe in the center of Malawi, and the city of Blantyre in the south of Malawi all have at least one road named after Kenyatta. All this is because the founders of my nation wanted to make it clear for generations to come that those celebrated as heroes in Kenya's struggle for independence are celebrated as heroes in Malawi.
Well, for the latest, we're now joined by Dr. Davji Bhimji Atellah, who's the National Secretary General at the Kenya Medical Practitioners. Thank you very much indeed for joining us, and welcome to the program.
Thank you so much, Peter Ndoro.
So when politicians announce things, we often take it with a bit of skepticism in terms of why and the timing. Does this lifting of the curfew make sense from a medical point of view?
I think the issue of lifting curfews is driven by two forces. At one point, the different bodies, both the union that we represent, that is the Kenya Medical Practitioners, Pharmacist and Dentist Union, the lobby groups, and the civil society organizations, and even the political organization, they were trying to ask what ascertains the curfews that have been there ongoing since 27th of March. And this has been because of the waves, the way we've seen the different waves coming. We had the first wave, the second wave, the third wave, and the fourth wave, which started in June and has been going up to date. based on the data the Ministry of Health has been releasing continuously for the last 2 months, there's been a steady decrease in terms of the positivity rates that have been reporting in the Ministry of Health. There's also a reduction in the hospitalizations as they report, to the point that the last 3 weeks, they've been really reporting very low numbers. And even the number of deaths for the last 3 weeks, they've reported only 6. And therefore, it comes down that the ministry was describing that Kenya has met the WHO criteria for downgrading the restrictions. So these, I believe, has also been indicated by the number of hospitalizations that we have, the number of patients that we've been having in the hospitals. We look at in the last, in the month of August, the month of September and the month of October, the numbers have been reducing to the those who were admitted in the 1st of September and those who were admitted on 19th are half the numbers. That is September 1,000 and yesterday was 500, according to the Ministry of Health. So I think these are what has brought down the discussions that resulted into the lifting up of the curfews today. But ideally, as we see the situation, we believe that probably this is due to the herd immunity that people have been developing, as much as vaccination has been low, could result into the low numbers that we are seeing, and that has probably resulted into the uplifting of the curfews. The other important thing you must note, the political activities. We are headed to the election in next year. Different leaders want a right to campaign in different scenarios. That also has given a lot of pressure to the president and to the country to bring about the opening up of the or lifting up of the COVID. The other thing is the business leaders. We have the Alcohol Beverage Association of Kenya, who have been really giving a lot of pressure because of low economy. The bars have been only operating up to 7 p.m. We have the border riders, we have the public transport system, which have been, as well as they've been full, but within a given time, they close down. So I believe this pressure, together with the data that are coming from the Ministry of Health, that has made it, has made the president now to actually lift up the restrictions that have been there over 1 year, 6 months.
As a medical community, do you think that enough people have been vaccinated so that the chances of another problematic wave coming are less?
Ideally, if we look at Kenya as at now, that is of today, the country has received about 7.5 million doses of the vaccine, according to the Ministry of Health database. And the numbers that have received the first dose is about 4.5 million. So the numbers that is fully vaccinated in the country is 4.3% of Kenyans. So ideally, the vaccination rate in the country is still low. But then there is availability of vaccine to a given extent that the complaint by the communities or by the citizen has reduced. So one thing that I think we've been doing as Doctors Union is to urge the community and implore the Kenyans to go and get the vaccine, and also continuously to ask the government to really provide vaccines and make them available to every region, both rural and urban areas. Because you realize that the vaccinations, for example, in Nairobi, which has a population of about 10 million, is about 10%, which is 1 million. But when you go to the rural regions, the vaccination rate is up to 0.2%. So overall, the vaccination of the country is still very low. So there's really need to do more vaccination. So many people need to be vaccinated so as to stay away from getting into fifth wave, which is also a possibility, because as we all know, the virus has always just recur in the infection. Yes.
Are you at all concerned about the increase in capacity at churches? And I say this on the back of South Korea. I remember that more than half of the cases in the country emanated from one church. So these have been traditional spreader events and spreader places. And to jump from 1/3 to 2/3 is quite a jump, isn't it?
Well, there's one thing that has been happening in the country that will make that a big significance, in the sense that we have public transport and we have the vehicles that move in the country. We have the aeroplanes. They actually fall into capacity. So if the increment in the church is made from 1/3 into 2/3, there will be need to have more containment measures used in terms of using the social distance and using the mask. But if you look at other institutions like the transport system, it has been always full. So I think with the opening up of the church, it's a 50. I would say it's a probability issue in terms of the spread that will occur in the churches, as long as they tend to use the masks and also to wash their hands. We may need to really see how much spread will occur. We can't say entirely that the spread, because as of now, during the daytime, we've seen many people gathering into political gatherings that have been ongoing. As I said earlier, the campaigns have begun in the country, and there are a lot of political gatherings that happen in every place and every time when people are moving. So probably I will just say the Delta variant that was strong initially, the infectious rate, I think, may have reduced as per now with this fourth wave. But then if a new strain then emerges, then that will also require a different approach for the same.
As a medical fraternity, what's your biggest fear and concern, perhaps, in the coming days with this lifting of restrictions?
I think with the lifting of restrictions, there's need to have more vaccinations. As much as we have 7.5 million doses that have been available in the country, with a target to have 10 million Kenyans vaccinated by December and the entire population vaccinated by next year, that will be of more great help to the Kenyans and to the country at this time. So I think that's one thing that needs to be done. But if that is not done, and then the curfews are lifted, and then there emerges a new strain, then I think then more people will again be infected. The other thing that needs to really be done, that we have been really advocating for and asking the government to really do, is to employ more healthcare workers. We have seen consistently from last year March to this year March that there have not been, the healthcare workers have been really strained in terms of their working hours, and they have been overworked, and they're actually few. There's a big shortage. So we are really advocating and pushing the government to really employ healthcare workers, because their value has been shown during this COVID and during the high infection rates that have been seen in the hospitals and in different facilities in the country.
All right. So mad working hours, very stressed environment. But are you getting enough protection as medical practitioners? I know that there was a concern at one stage about PPEs and other protection.
Yeah, I think initially there were shortages of these PPEs, and I think even in December last year, that's after about 7 months of COVID ravaging the country, the healthcare workers, that's the doctors and the nurses, gave a strike notice demanding for protections, for the PPEs to be provided. I think at this time, mostly the country was relying on importation of the PPEs. But I think since many organizations, the equity foundations, different NGOs came on board, the manufacturing started happening in the country, I think that the burden of PPE reduced. In terms of quality of the PPEs, the quantities, I think, reduced. So it really did not become much of the issue to many healthcare workers. But then what became an issue was the availability of the ICU beds for the patients who are severely infected with COVID, and also the ventilators. That became a challenge, and I think it's still a challenge if we get another wave currently. And as I said, the personnel also will be a challenge.
All right, that's where we're going to have to leave it. But thank you very, very much indeed for giving us some insights on this milestone of some of the restrictions being lifted in Kenya. Thank you for your time.
Thank you so much.